Welcome, everyone, to the Women's Health and Fertility Podcast. Today's guest is a dear friend and a sister in wellness, Dr. Nicole Cozean. Dr. Nicole founded PelvicSanity to provide the type of care she believes that all people with pelvic health deserve. In the 7 years since its inception, PelvicSanity has become one of the best known clinics in the country, with complex patients routinely flying in for treatment. Nicole is also one of the foremost educators in pelvic health. She has trained more than 1,500 clinicians in the pelvic sanity treatment approach, and she runs a teaching group for 10,000 plus practitioners and runs an annual conference in Atlanta called Pelvicon for pelvic rehab professionals. As the award winning author of The Interstitial Cystitis Solution, Nicole has been an advocate for patients and better care for almost 2 decades. She personally handpicks and trains each member of the staff to ensure that every patient at Pelvic Sanity is getting world renowned care. Nicole makes her home in San Clemente with her husband Jesse, her son Clay, and one more on the way, and of course, her cats, Mitty and Ziggy. Well, thank you so much, Dr. Nicole, for joining me today for the podcast. And I was thinking about how long we've known each other. And I think it's been about 9 years. And the reason why I think we first met was I had received some of your brochures and business cards back when I was in Costa Mesa. And I thought, gosh, it'd be great to connect with a pelvic floor therapist, especially because I was opening up a satellite clinic, which at the time I didn't realize how close it was going to be to your practice. And it was also in Laguna Hills. And then when I found out where you were located, I thought we definitely need to get together, connect, have lunch, and which we did. And I think the rest is history. I'm so glad that that you returned my call and we set up that appointment to meet. And I just feel like we've had so much fun and success collaborating, co-treating over the last 9 years. So
Yeah. Well, thanks, Tina, so much for having me. Gosh, when I was reminiscing on that too, I was like, I think you were one of the first people to really come into the practice and see my location. And I remember you brought me I think you brought me like a succulent or something. And I was like, wow, it's so nice. And you were just like, yeah, women businesses. And I was like, this is so great. So
Oh,
very welcoming. And then, yeah, the rest is history. Now we've become, I mean, I've been your patient for a long time. You've helped me through some pretty tough stuff. So we're going to get into that a little bit on this
yeah,
podcast.
for sure.
Yeah, it's just been a great resource for our patients as well at Pelvic Sanity.
Likewise. I mean, I who would have known that we would have forged such a powerful partnership and collaboration for our clinics to work together to care for our patients. And, I think I have learned so much about pelvic floor health from you that,
Mhm.
even when I had my kids, there was no education. This is like 22 plus years ago, and I think there was a lot of deficiencies in that area, especially when you're having a lot of pain and discomfort after having a baby. And it's just like, well, that's just how it is. And you'll
Yeah,
heal on
it's
your
more
own. It takes time. So,
Yep, it's just more like, "Yeah, just wait," and then you tell your friends about it, they have it too, so you kind of are like, "Oh, well, must be just part of the path of motherhood," and I think that what you bring up a great point too, that I think I've been a pelvic floor therapist for almost 20 years, which is crazy, but that's true, and, back then, everyone thought that this part of physical therapy was just very weird. No one kind of
mm,
understood it. No one if you could get into a room of 100 people and maybe a few people would raise their hand if you asked the question, "Who here has heard of the pelvic floor?" And now, over the last, I would even say 5 years, the if you look and see, like, the Google search term for pelvic floor and pelvic floor physical therapy, it
mm,
is gone, infinitely huge in terms of search terms, which means that people are understanding about it more,
right,
which means that
right.
more and more people are talking about it. I think that honestly, the rise of social media and TikTok and Instagram and just the way that people get health information now has changed over those last 5 to 8 years. And that really has helped our field and our specialty area of physical therapy really take off. And so it's super fun for me to see the evolution of knowledge And there are blessings and curses with that, right? So more people are hearing about it, but there's also a lot of myths to bust and
Mhm.
misinformation even that goes around about what you should be doing at home for your pelvic floor and what this means if you have X diagnosis. And so
Totally.
it's really cool to see how people are just more aware of the pelvic floor. So we're all always very grateful for that. But yeah, it's a different ball game now than it was even 5 years ago.
For sure, and I can see the demand increase in my practice too. Just in conversations with our acupuncture patients, they will ask us oftentimes, "Hey, do you have someone to refer for pelvic floor health?" Or,
Mhm.
"What do you think about pelvic floor therapy? Should I look into it?" And of course, our answer is always yes,
Yeah.
definitely. So I think that it's really cool that women are more informed and more empowered to ask for the help that they need in whatever
Yeah.
phase of life they're in because,
Yeah.
it's just such an integral part of our overall health.
And I
And
think it speaks a lot to a little bit of I think Western medicine can be really helpful for a narrow subset of issues, but once you get outside of their areas of expertise, I really feel like that's where a lot of patients now have sort of taken their own care into their own hands and really started to seek out answers, especially women now who are like, "I'm not gonna settle for this." The answer of, "Oh, this leakage or whatever happens just because I had a baby
mm,
or I'm having painful intercourse," you know, used to be like, "Well,
brushed
you know
off.
yeah,
Yeah,
brushed off, like, "Have a
yeah,
glass of wine, don't worry about it, you must be a little bit anxious." And I think
right.
this generation of women are now, like, not settling for that, and in this age where you can have so much more information at your fingertips, I think that that is really where, people are starting to advocate for themselves and saying, like, Actually, that's not good enough, I'm gonna find another answer." And I think that that's really where this holistic care of that whole area has really improved, and it's exciting for both your specialty and ours,
Mhm.
that go hand in hand so well that people are demanding essentially better care from all of their providers. And so it's exciting for them to be able to find help in people like you and I, that they wouldn't necessarily have been able to find from a Western medicine perspective before.
Absolutely, and I think it's just gonna continue to grow and
Hmm.
progress. That trend is just gonna continue. So, well, this brings up kind of an interesting question. I get this topic comes up a lot in conversations with patients, especially because we're treating women in all phases of life, as you are too. So, I would love to hear about like what is some of the best times for a patient to come in for pelvic floor treatment, and what are some of the benefits of receiving care?
Yeah. So just to take a half a beat back for a second. So for those of you who listening to this podcast, and you're like, they keep talking about pelvic floor therapy. Like, what does that actually mean?
Yes, please.
So
Let's go
so
back to just the basic
just like
definition.
basics, and then I'll
Yes,
answer
please.
your question, right? So there is so we are all rehab professionals. So at our clinic in Pelvic Sanity, are made up of primarily physical therapists, but we also have an occupational therapist on staff.
Hmm.
So those are the rehab professionals, the same type of people that will help you after a surgery or help you with back pain or see you after a stroke. So physical therapy itself is a pretty broad um, discipline that helps movement, exercise, um, if you have pain with any part of movement or exercise or sport, those are the kinds of people that you can go to. Now, in after that umbrella, there's a bunch of different subspecialties of physical therapy, or rehab, and pelvic physical therapy is one of those. And women's health is another subspecialty, even of
Sure.
that. We also treat
Mhm.
men at our clinic. So men and women's health. And so basically the area of pelvic floor physical therapy, when you hear that term, it is a physical therapist that specializes in either pregnancy or postpartum, men's pelvic health, which we won't get into a ton on this podcast because that's not the focus, but everyone has a pelvic floor, just FYI. And then, or somebody
Thanks
that
for
has,
clarifying that,
yeah,
Nicole.
we're not that different.
Sure.
Um, but or some sort of pelvic pain condition. And so those are the 3 major areas that we can help people with. And, when you think about all of those different areas, then you can think about across a lifespan, we can see folks, there are pediatric pelvic floor physical therapy clinics
Hmm.
that also help with potty training and sensory dysfunctions. We don't do that at Pelvic Sanity, but that's another subspecialty of pelvic floor therapy. Or if a kid is bedwetting well into their, early teenage years, like that's a whole different subset. We don't do that at Pelvic Sanity, but that's just an interesting thing to note.
Hmm.
But now if you think about, pelvic pain conditions, now we're talking about things like painful periods and endometriosis and bladder conditions and bladder dysfunctions and incontinence when you're running or doing a sport or gymnastics or something like that. And so we can see folks from at Pelvic Sanity, we have age ranges from like 14 or 15 kids in high school that are having some of these more menstrual health related
Hmm.
problems, or problems with when they're playing their sport or being active, all the way until like postmenopausal women that are still trying to be active but maybe having pain with intercourse, osteoporosis, those things like that. So the women's health specialty is really pretty broad. Um, but those are some of the major just common big areas that we can treat. And so the other way to look at it is that we can our pelvic floor muscles are areas of our muscles in the pelvis that control bladder, bowel, sexual functioning, and some orthopedic things like with your back and your tailbone and your hip. So if you have any issues around peeing, pooping, sex, or basically things you don't want to talk about at the dinner table,
Sure.
um, and maybe a little bit of like low back pain that maybe hasn't
Mm.
gotten better with the traditional route of, ignore it for a while, just take some ibuprofen,
Right.
or, some of the, orthopedic physical therapy things, then sometimes if you have any one of those other things, or you've had a baby before, or you're in perimenopause, then those are some of the areas that we can also address because sometimes those things can be coming from your pelvic floor, which is why you haven't seen success during some of the more like mainstream routes of getting rehab.
Right, that makes a lot of sense. Or if you're not responding to like massage or chiropractic
Yes.
care or even acupuncture. So I think
Yeah.
that's one of the best times for us to refer out is definitely when, even for like low back pain that's not responding and a patient maybe also has painful menstruation, maybe hasn't quite been diagnosed with endometriosis, but there's suspicion that
Yeah, suspicion. And I
Mhm.
think that the other thing to note about what pelvic floor therapists do that is different than maybe another practitioner would be that part of our postgraduate training. So we go to school for 4 years of undergrad, we go to school for about 3 years on average and get a doctorate in physical therapy, and then we do extra special training in pelvic floor examination and treatment with all of those conditions that I just talked about. But that training specifically after we go through that 7 years of postgraduate stuff is a unique ability to do an internal assessment of those pelvic floor muscles as well. So, all of
Ooh,
those muscles
yes,
that I
tell us more
described.
about that. Yeah,
Yeah, so
I
everyone's
hear
kinda
the
like,
term
you do.
internal versus external
Yes, and you kinda hear
examination.
like right, and you kinda
Mhm.
hear the, like, the, "Wait, what are you gonna do?" Um, but here's the deal, right? So if you think about the pelvic floor muscles are actually quite hidden, essentially. You can't really you can see them a little bit, but they're underneath the big glute muscles, they're
Mhm.
attached to the inner thigh muscles, they are up inside, essentially, your pelvis, and they have 4 major functions. They help bladder control and bowel control, they help, support all of your pelvic organs. They have sexual functioning, and they help to provide stability for your back, your spine, and your hips and tailbone. So what we have the ability to do in our special training is to do an internal exam of those pelvic floor muscles, which is not like nothing like a regular gynecology appointment. At our clinics, there's no stirrups, there's no speculum. We usually just
Mhm,
use one gloved finger and
mhm,
can actually feel the pelvic floor. And so if you kind of think about this, if you went to a regular physical therapist for your back, they would have you probably take roll up your shirt, they would look at your back, they would watch you move, they would ask you different questions about what makes it worse and what makes it better, they would touch your back, they would look at the muscles around it, and they would help you to determine what the pain is coming from. In the pelvic floor, there's not really another way to do that really well
right.
unless we do that. Now, if somebody is a little bit apprehensive about getting an internal examination, we do not have to do that, but it certainly gives us a very unique look and a more thorough picture about what might be going on with some of your symptoms that you're describing. And so that is one of the extra special areas that we can do um, at our clinics. And so we can glean so much information about what the pelvic floor is doing. Is it too tense? Is there one side that is um, overworking versus the other side? Is
Mhm.
do you have an old hip injury on one side that has created a compensation that now means that, when you have to pee really bad, you can't hold it in that great? There's all kinds of stuff that we can look at and find out by actually assessing the muscles that we think are the problem in the first place.
Thank you so much for that description. That makes so much sense because that question comes up a lot. A lot of
Yeah, and
patients
people are
ask,
like,
like, what exactly, how do they evaluate what your
right.
pelvic floor status is? So I
And if
think
you're
that,
going to a good therapy place, our place looks more like a massage area than it does a
mhm,
gynecology table. So if you're apprehensive, if you've had history of pain with a gynecological exam, we can also help you tolerate that more. If you're going through fertility treatments and you're having
sure.
trouble with the transvaginal ultrasound, which is very common. And your reproductive endocrinologist is kind of looking at you like, what's the problem? This isn't that big. It's not.
Right.
Most people can tolerate it pretty fine. A lot of times
Mhm.
you might have a lot of tension built up in your pelvic floor that we can help with. So that is one of the unique areas of our training that I think allows us to evaluate people in a very different way than they've ever been evaluated before, and therefore we can uncover a lot of things that might explain their symptoms a lot better than just guessing at at why you might be having some of these issues.
Right. Well, so as far as treatment, how does treatment work then? Is it also like a combination of internal and external treatment?
Great question. And so this is where you kind of get a distinction between, because I know on your list, Tina, there's probably a question about like, well, what comprises of good pelvic floor therapy, right?
Right.
So I really am very passionate. I teach these techniques all around the country, and we even have an international conference that we teach other practitioners and how to do this well. But good pelvic floor therapy, in my opinion, is both. It is both taking into account external factors, things like, I mean, things all the way up to your rib cage and your neck and your shoulders can
Wow.
influence your pelvis and how it
Mhm.
moves. Things all the way down to your foot can influence how the pelvis and pelvic floor muscles activate and move. And so I think it's really important to incorporate a head to toe evaluation externally first, um, to get a picture of your whole entire movement system, and also then incorporate a pelvic floor internal exam if we both decide that that's what we want to be doing, and then combining those treatments um, in the hour that we have with you every week, then would basically mean that some part of the session is external based, some part of the session is internal based, and that varies. The percentage essentially of time that we spend in each of those areas varies with your particular symptoms and presentation and what we think is actually going on and from a big picture standpoint. And then
Sure.
we're also really, especially at PelvicSanity, but this is how I teach other practitioners, is to also take into consideration the nervous system component,
Mhm.
because a lot of the pelvic floor conditions that we just talked about and the pelvic floor functions, are automatic. And so there's a whole nervous system that is specialized in those automatic functions. So the reason why you don't necessarily like hopefully none of us are peeing right now and we don't want to when we're listening to this podcast, whether you're walking at the
Yes.
gym or
Right.
driving or something,
Right.
right? Our pelvic floors are activated and on automatically without us having to think about it.
Mhm.
So because they're innervated uniquely like that, then we also can help to treat the automatic or autonomic nervous system to help with better function of the pelvic floor. And that also um, is something that not all pelvic floor physical therapists are trained in. So it's those three things is like taking into the nervous system, taking into the orthopedic and external factors, and being able to do an internal exam if appropriate. I think are the three great things to look for if you're getting good pelvic floor care.
That's fascinating. That's really important, and thank you for sharing that. So, for those listeners that are not local, and if they are looking for a therapist, it's really important to know those things.
Mhm.
So, as far as conditions that you all commonly treat, just to kind of to give like a spectrum of things, and
Mhm.
I know that it sounds like pelvic floor therapy is helpful for both men and women, all phases of life. So
Mhm.
fascinating about pediatrics. I didn't realize that.
Yeah.
Bedwetting, that's so good to know.
Mhm. Mhm.
So just curious for in your experience, what are some of the common things that you all have treated?
Right, so I would say let's go with, functions of the pelvic floor, and then we'll talk about the dysfunctions that we can treat around that, right? So if we talk about the bladder function, the dysfunctions around that that we can treat are things like incontinence, which is involuntary loss of urine with
Mhm.
coughing, laughing, sneezing, or urge to go. So you can get a really strong urge to go and then not quite make it to the bathroom. We can treat things like urgency and frequency of urination. So maybe you don't lose any urine, but you have this nagging feeling like you have like you're basically about to get a UTI, but you don't,
Yes.
and you're going a lot.
Right.
Um, there's that. There is things like for the supportive function of the pelvic floor. So there's pelvic organ prolapse. So the fascial connections and the muscles of the pelvic floor actually create a bowl that your organs sit on. So a lot of times, some postpartum issues, and you don't have to be postpartum, but if you have a hypermobility disorder,
Mm.
like Ehlers-Danlos syndrome or
Yes.
a connective tissue disorder, sometimes those that fascia is a little bit more lax, and that connective tissue is a little bit more lax. That has maybe your bladder coming down into the vaginal canal a little bit more, maybe your uterus or your rectum, and so that can cause some heaviness and pressure feeling. Maybe it can even be impeding your bowel movements. So if you feel like sometimes you have to like strain or move in a different way in order to get your poo to come out in a
Mm.
different
Mm.
fashion. Sometimes that can it doesn't mean that you definitely have a prolapse, but that is a very common symptom of that. Um, any bowel dysfunction, so constipation, um, straining when you poop, painful poops, can be helped with pelvic floor therapy. Fissures, if you have any sort of fissure or hemorrhoids, even, or because there's a faulty intra-abdominal pressure system where you're not utilizing your breath very well, in with things like lifting, so that we can help with that. There's sexual functioning, so any sort of pain with penetration, no matter what you're putting in there, or if there is any like decreased orgasm
Mhm.
sensation.
Mhm.
We even see people that have a hyper orgasmic sensation, which sounds fun for a half a beat until you actually have it. And it can actually be terrible to feel like you're on the verge of having an orgasm all the time. Those are like some pelvic pain conditions. There's things like vulvodynia, where you have a hypersensitivity around the opening of the vaginal canal
Mm.
that makes insertion painful. And then we have like other things like um, actual diagnosed conditions like endometriosis, interstitial cystitis, pudendal neuralgia. Those kinds of pelvic pain conditions can also in fact impact and influence how the pelvic floor is functioning. And most of the time, and this is a big generalization, but most of the time, if you have any sort of pelvic pain or back pain or hip pain, your pelvic floor is going to be more overactive than it is underactive. So it's one of the big myths I think that people assume that when you have a pelvic floor problem, oh, your pelvic floor is weak because you
Mhm.
had a baby or something like that. And
Right.
that actually is, I would probably say that 85 to 90% of all of our patients, no matter what they come in for, incontinence, prolapse, or pelvic pain condition, actually have a pelvic floor that is too tense and tight that creates a dysfunction like weakness or creates a dysfunction like pain. And so it's all about normalizing the tone in the pelvic floor and restoring its function to be able to do whatever it needs to do.
What sounds very much like Chinese medicine, where you're trying to create this like homeostasis and this
Yeah, like a
balance,
balance.
right?
Yeah, right?
That's very
Which
cool.
is also why, if you've been told, because the other thing that people will ask a lot of times is like, well, should I be doing my Kegels? Because that's
Mm.
another sort of
Yeah.
misnomer about like, well, pelvic floor therapists will teach you how to do Kegels correctly. And that you might have even heard that from your OBGYN or somebody that you think knows about the pelvic floor. And the reality is those folks don't actually know as much about the pelvic floor as you might think they do. But that's the other reason why we don't want people to just blindly start Kegel exercises without a good assessment. Because just like if you had a calf cramp after walking, you wouldn't want to do a bunch of things that contract your calf, or you wouldn't want to do a bunch of heel raises, right? You would want to stretch out and relax and get that cramp to go away. Doing a Kegel when if you have already tense and tight pelvic floor muscles is perpetuating that problem. And so even though there are all over the internet and all over social media,
Yes.
to pelvic floor therapists, that's like nails on a chalkboard if you haven't been actually told to do them by a pelvic floor therapist and assessed in the correct way to figure out why your pelvic floor is like that in the first place. So that may be something that we do when we get that homeostasis back to a resting tone of your pelvic floor that's good so that it can both contract and relax well. But we don't wanna just start blindly strengthening your pelvic floor if we don't know what we're starting with, if that makes
Right.
sense.
That makes a lot of sense. You got to know what your baseline is.
Yeah, and it's so important, and that's where it's like a lot of people that are, again, like I said, social media and the information age online is like a blessing and a curse. It's so great that people are, like, looking like how to do Kegel exercises. Well, I have incontinence. But there's a million and one reasons why you personally might be having incontinence, and so that's where we really advocate to get a really individualized assessment from a good pelvic floor therapist that's gonna look at the whole body and really figure out for you, why are you having this symptom, instead of trying to fix it yourself.
Totally, and that's it's funny because we're all just so, like, proactive, right? We're like, "Okay, DIY, I'm gonna do this on my
Mhm.
own." So,
Right.
let me see what I can search for and try to incorporate, but that makes a lot of sense to be able to have the proper assessment, know what your baseline is, and know what's actually going to provide a positive effect versus maybe, you wanna avoid anything that might actually make it worse, which it sounds like it can if
Totally, and
you're
you
not
don't
doing it
want to
the
just
correct
I mean,
way.
and even if and even to use an analogy in your world, right? Even if someone, like, looked up some acupressure points
Mhm.
and did their own stuff, right? It's like, that's great, and that might work in the short term, but is that really gonna get you the lasting balance or the lasting relief and the true getting back that homeostasis? Probably not, right? Until you're actually getting an expert to see your whole body and your whole system. So it'd be
Right.
the same thing. So even if somebody has done a home program or done some Kegels at a stoplight and been like, "Oh, that's actually helping," it's like, "That's
Mhm.
awesome. That gives us information," but it might not give us the long-term effect that we might need to make sure that and at Pelvic Sanity, one of our mottos is like, we want your symptoms to not only go away, but we want them to stay away.
Totally, for sure.
So that's the kind of thing that we're actually
Yeah.
looking for, that lasting relief at Pelvic Sanity. And usually it's a lot more complex than just doing a couple Kegels at some stoplight,
Mhm.
off of a piece of paper or someone you heard about on Instagram.
Right. So long-term effects for sure, and then also
Yes.
treating the root cause of
Yes.
the imbalance or the dysfunction.
Yes.
Yeah, that's key.